Hi, my name is Cheryl Robertson, and I'm presenting my project, Support Intervention Abates Postpartum Depression. Postpartum depression has significance for nursing, as evidenced by the number of women affected by PPD and the devastating effects that this illness has on both mother and child. PPD can rob mothers of precious time with their newborns and their families, due to often uncontrollable emotions and thoughts, and frequently their actions. PPD occurs in up to 1/5 of women in the United States and is the most common complication associated with pregnancy and childbirth. It is a major public health problem and a thief that steals motherhood. Education on the research findings and the recommended intervention through the dissemination of information to change patient care and improve outcomes through increase in awareness of the need for PPD support groups was provided with my presentation. The target audience was advanced practitioners such as FNPs and midwives, and nurses caring for postnatal women such as in obstetrician and gynecologist offices or in the labor and delivery unit, and the community resources affiliated with the Indian River Medical Center expressly for the purpose of providing support services for moms and their babies. The synthesis of research findings summarized 8 primary studies. 7 of the studies had postpartum mothers, with samples ranging from 5 to 1,719 participants, while the 8th study used 512 online postings as sample. All of the studies concluded that support groups of peers in varying venues, from in-person discussions to creative forums to telephone support, were critical to the thwarting, help and management, or reduction in PPD. The research findings represented in the presentation validate the benefits of support groups in the abatement of PPD for postnatal women, offering an outlet for the expression of thoughts and emotions for both primiparous and multiparous women. The presentation was given at Partners on July 16, 2014 at noon, with 8 people in attendance, including 1 doctor, 2 nurse practitioners, 2 social workers, and 3 registered nurses. Included was a succinct review of studies and literature, including a handout with the evidence-based practice research data and a list of the interdisciplinary support groups that the care providers could utilize as a handout to their clients, as well as a time to answer any questions. Strengths of the project included presentation to the stakeholders associated with Indian River Medical Center, providing education on evidence-based practice research findings, including the critical need for the recommended intervention, while increasing the awareness of the documented success of PPD support groups and the need to implement a postpartum support group or groups in our community, which will change patient care and improve patient outcomes for this patient population in the community. Feedback on the presentation from the target audience reinforced the need and acceptance of the intervention and evoked questions and thoughts from the audience regarding determination of who would facilitate and how the group would be funded. Some changes which could be made for the project implementation include more follow-up regarding confirming the date and time of the presentation, more actively recruiting additional stakeholders to be attendees at the presentation, and a change of venue for the presentation, seeking to present at Healthy Start Agency, as the stakeholders at Healthy Start are more directly associated with and connected to the women who would be participants in the PPD support group, as they interact with these women from delivery through their children reaching age 3. Research indicates support groups offer benefits for both primiparous and multiparous women, benefiting the mothers, their babies, and the entire family, and are a significant factor in the occurrence of, longevity in, and severity experienced with PPD. The greatest obstacle found is the funding and determination of where the responsibility for the implementation of the support group, including the personnel, would lie. Thank you very much.